Of late, following COVID, we have seen very young patients in their 20s, 30s and 40s where there is avascular necrosis of the hip joint and the possibility of a hip replacement in these patients is being discussed. And whether to do the surgery or not is a catch-22 situation because it really comes down to the patient profile and also what the patient wants at the end of the day. Lesser pain, better activity, and this is what you should always remember, that is the pain the main reason why you're not enjoying your life? And if so, then it is a good idea to go for surgery. The concern about how long the implant lasts does not hold good in the current day because of improvement in surgical technique, improvement in the quality of implants, and also surgical techniques like robotics which ensure that the accuracy of the operation is not compromised. The condition of your bones is usually likely to be good and your activity levels you aspire for need to be higher, and therefore early surgery will make you have more years of life with more joy, and this will entail a higher risk of maybe somewhat revision surgery when you are 30-35 years down with this particular joint. Nowadays, the early surgery recovery is improved with advanced technology and approaches like direct anterior approach. And most part, these patients who are suffering with severe pain would be better off with early hip surgery than later surgery. However, one has to be wise about it. Just with a diagnosis, you must not go for the surgical intervention. The pain is interfering with activities of daily living. Then you choose the right doctor, set your right expectations, and do the good rehabilitation with adequate expertise in order to get a proper recovery. Do not be afraid to get a second opinion or a third opinion, but remember that quality of life, severe pain, necessity to take daily painkiller, and having a poor quality of life because of this particular pain are the primary determinants of surgical intervention, and it is not the age which determines whether you get a surgery or you don't get a surgery.